Hi, good morning everyone. This is Sir Elias A. Alicaya Jr., your Assistant Schools Division Superintendent here at SDO Cavite Province. For so many years, we are always adhering to the quality services that our office delivers. And we always believe that successful organizations have healthy and happy employees. But do you know that for so many years, we always see to it that the health condition of our personnel is our main priority because they cannot work freely and they cannot work effectively if their physical body cannot work as well. Out of 243 division office personnel, may I give you some data? We have 116 female married personnel. And out of 116 division office personnel, 44 of them have normal BMI. 42 are overweight and 24 are obese class 1. The 3 are obese class 2 and the remaining 3 is obese class 3. Looking on this data, I think this is not good for those who categorize themselves on obese and overweight. I think that's okay for 44 for normal, but the remaining statistics, I think we need to give priority and we need to give more attention to. Having an office with an ISO certification and sooner a PQA recipient organization, we should also give priority on our people. We should also give priority on the quality of our people working together so that they will achieve our end results. This is the main reason why we conducted an analysis of DepEd Cavite Division personnel health data. We want to explore the family history, the medical history, the dietary intake and lifestyle of our division office personnel. This research project was conducted by yours truly and with the members of the team. We have our SEPs in planning and research, si Ma'am May and Joy D. Romanes. We also have two brilliant nurses in division office. We have Julius Bryan A. Herrera and Glaizelle M. Rodrin. Looking on the different factors affecting the research, do you know that the family history is one of the strongest influences on the risk of developing diseases? Meron tayo cancer, diabetes, asthma, heart disease, Alzheimer's disease, and many more. And that is according to the study of Stephens on 2016. If you will ask me, sir, how about medical history? Medical history tells about the health issues of any one of us. Maybe this is at risk for the future. And the dietary intake protects the body against malnutrition in all its forms as well as non-communicable diseases. This is the diabetes, heart disease, stroke, and cancer. And this was found out by World Health Organization in the year 2018. Did you know that 60% of related factors to individual health and quality of life are correlated also to lifestyle? And this according to Siglio, Curry, et al. In the year 2015.
Sir Ellie have discussed the four components of the health data that we have explored in this study. Our research question is there any significant relationship among the demographic profiles and the components of family history, medical history, dietary intake, and lifestyle patterns of the DepEd Cavite Division personnel? We have looked into the five factors in this study: the family history, medical history, dietary intake, lifestyle, and demographic profile. For the family history, we have looked into the following components: hypertension, stroke, heart attack, diabetes mellitus, asthma, cancer, and kidney disease. As for the medical history, we looked into the blood pressure, height and weight, BMI, central adiposity, signs of angina, signs of stroke, and diabetes mellitus. For the dietary intake, we have looked into the intake of the personnel in terms of fat or salt, fruit, and vegetables. For the lifestyle, we have looked if they are smoking, if they are taking alcohol, or if they do exercise. For the demographic profile, we have looked into the age, sex, civil status, and salary grade of the participants. We have invited a total of 243 DepEd Cavite Division personnel. However, only 158 have participated in our study. This sample size have a confidence level of 95% and a confidence interval of 4.62. Findings and conclusions will be discussed by two of our brilliant nurses in DepEd Cavite, Nurse Julius and Nurse Ice.
Finding shows that all factors examined were not associated with each other except for the following: female and central adiposity, and merit and central adiposity. Spearman's rule, chi-square, and linear regression were used to determine the relationship between and among the variables in this study. To determine the relationship between sex and family history, civil status and family history, medical history between sex and angina, civil status and angina, sex and heart attack, civil status and heart attack, sex and diabetes, civil status and diabetes. The chi-square was used. The findings revealed, however, that there was no significant relationship between all these variables.
Nevertheless, out of the variables explored that might have a relationship with one's predisposition to lifestyle diseases, only sex and civil status had significant relationship with the formation of central adiposity, which coincides with the findings of Sun, Liu, and Snetzeler, stating that the higher levels of central adiposity means higher risk for obesity-related health issues, including premature death. This is furthermore supported by Talwar, who reiterated that women are more susceptible to non-communicable diseases and reproductive-related illnesses. Also, based on NCD in women, non-communicable diseases have been the leading causes of death among women globally for at least the past 3 decades and are now responsible for 2 in every 3 deaths among women each year.
Guys, there you have it. Miss May Ann Joy D. Romanes discussed the research questions and methodology, while Julius Bryan A. Herrera presented the findings, and finally, Ma'am Glaizelle M. Rodrin presented the conclusion on analysis of DepEd Cavite Division personal health data, and we explored the family history, we explored medical history, dietary intake, and lifestyle. So I am appealing to everyone, most especially to our school heads, to please take care our people. Please look at the related researches which affects the performance of our people. We should love our people. We should do our best to make our people comfortable in doing their job. And we should always see to it that they are healthy in doing their job. Because at the end of the day, people is still the treasure of any organization. Again, thank you everyone. Mabuhay.